Screening tests like PSA can increase a doctor's suspicion that you have prostate cancer. And a biopsy confirms it by examining a tiny piece under a microscope. But what is the relationship of your prostate to the rest of your anatomy? Is there any chance the disease could involve other organs or have jumped elsewhere? Also, imaging can be before treatment to help determine when it will be needed or after treatment if questions remain. One can only learn so much from the rectal exam. Thankfully, your doctor has imaging techniques to examine your body to answer these questions. We've come a long way since exploratory surgery was required to examine a patient internally. Now, doctors can examine any part of you using painless imaging techniques. Each technique is a different tool, a different high-tech approach. Let's run through them. If you've had a biopsy, you've already benefited from one imaging tool, transrectal ultrasound. While you lie on a table, a lubricated probe is inserted into the rectum where it presses on the back of the prostate gland. Not really so different from the finger exam. High-energy, inaudible sound waves are used to visualize the prostate gland in real time, even as the probe is moved slightly. These images measure the prostate, examine the seminal vesicles and the prostatic capsule, and guide procedures like a biopsy or hydrogel placement. You can't feel the sound waves, and there's no radiation involved. CAT scans, MRIs, and PET scans are non-invasive and painless. You'll lie on a movable table while a radiology technician operates the machine from a nearby room. You will need to lie still, relax, and trust that you're in good hands. You can be seen and heard by the tech at all times. These exams all use different technologies, X-rays, magnetic and radio fields, and radiation to examine you. The scans can check out any part of your body from head to toe, but let's focus on how they're used most frequently in managing prostate cancer. The images will be carefully examined by a radiologist who will then share findings with your physician. The results can take a few days. Making sure the report is clear, precise, detailed, and accurate determines your course of treatment, so patience is the key. With a CAT scan, you move through a donut-shaped machine as X-rays pass through you from all directions and their absorption is measured. This information is reconstructed using computers to create a detailed model of your body. That's why CT stands for computed tomography. These black and white images clearly distinguish between dense tissues like bone, soft tissues like the prostate, and air. Sometimes IV contrast is given during the scan to increase the visibility of some structures. A different contrast can be given orally to highlight your digestive system. The scan itself is painless and takes just a few minutes. With an MRI, magnetic resonance imaging, a powerful magnetic field with carefully controlled radio waves is used to visualize subtle differences in soft tissue. There's a lot of complicated physics involved, but the key is that MRI provides the clearest view of the prostate cancer within the gland, helps determine whether it is invading the prostate capsule, seminal vesicles, bladder, or lymph nodes. All of that will be in the radiology report. An MRI is painless, but does require you to lie still in a narrow tube for longer than you might prefer, and can be a bit noisy. Sometimes IV contrast helps clarify an MRI scan. If you haven't had a biopsy proving prostate cancer yet, the radiologist will assign you a PIRAD score. This prostate imaging reporting and data system scale goes from 0 to 5. Radiologists use this score to estimate the probability of clinically significant prostate cancer being present. Because the MRI involves a powerful magnetic field, Your technician will inform you of some safety issues, being aware of metal objects brought into the room, and whether or not you have a pacemaker, defibrillator, or any orthopedic surgeries or accidents where metal was involved. Your tech will help with the questionnaire. While CAT scans and MRIs are excellent at defining the details of anatomy, basically where things are happening, PET scans answer the question, what is happening? PET stands for positron emission tomography. A tiny amount of radioactive isotope is attached to a biological substance and infused into you about an hour before the scan. This radiopharmaceutical binds to the target. When you are lying in the PET detector, the location and intensity of the radio tracer is measured, allowing a 3D reconstruction of how your body handled it. While some radiopharmaceuticals show areas of high metabolic activity, whether from cancer, infection, injury, or activity, newer agents are much more specific. For example, a target that binds specifically to PSMA, prostate-specific membrane antigen, is excellent at detecting prostate cells no matter where they are in the body. In preparing for a PET scan, it's very important to follow the instructions about what foods to avoid and when to stop eating and drinking beforehand. This is a highly important and detailed scan, so the directives must be followed to the letter. Some PET scans also have an integrated CAT scan, a PET-CT. This scan superimposes the functional activity from the PET onto the anatomic detail of the CAT scan. It's really amazing what they can do. Finally, a technetium bone scan infuses a small amount of radioisotope into your vein where it is absorbed by any areas of inflamed bone, indicating cancer, injury, or inflammation. The detector takes a picture of your skeleton, front and back. For men with higher risk prostate cancer, this scan is the best way to rule out metastatic involvement within your bones. How do you know what imaging is needed for you? Good question. In order to know what test to order, your doctors need to have an idea of what they're looking for and where it could be found. Radiology exams aren't usually necessary for low-risk disease, as the doctor isn't likely to see much of anything. On the other hand, if you're at higher risk of visible disease, multiple exams might be needed to confirm your precise situation. Learning about imaging tools and how they work in the fight against cancer takes the mystery out of all those letters, scans, and what they actually do. Look up the terms in the Fighting Cancer Network glossary if you need more detail, and talk to your doctor. Ask questions about your radiology reports. You deserve to know what they say about you and your body, and get a good idea of how you actually look in great detail from the inside out.